It's hard to believe that it's now been more than a year since our first episode of Here for Good. Since then, I've had the privilege of speaking with some truly impressive and accomplished individuals, Rhodes Scholars, politicians, physicians, journalists, CEOs, and more. But one thing that all of my guests have had in common is their dedication to being community servants. It gives me great pleasure to kick off a new season of Here for Good, a new season in a new year, which brings so much opportunity, optimism, and hope. A new year in which we will continue to talk with the people who are truly making a difference and embodies the spirit of Here for Good in their communities. With that, I'm pleased to welcome Season 2 first guest, Eugene Woods. Gene is the president and CEO of Atrium Health. Based in Charlotte, North Carolina, Atrium Health is one of the most comprehensive and integrated health systems in the country, comprised of 42 hospitals and over 70,000 team members and nearly 14 million patient interactions each year. Gene joined Atrium in 2016 and has since been recognized by Forbes as one of the best employers for diversity, new grads, and women, and is among the very best in the nation. With 30 years of experience, Gene is one of the most prominent healthcare leaders in the industry. He's also the recipient of a number of prestigious healthcare awards and recognitions, including being one of Modern Healthcare's 100 most influential people in healthcare. Also, Modern Healthcare's top 25 minority executives in healthcare, and one of the 100 great leaders in healthcare by Becker's Healthcare. And probably most importantly, a friend of mine. Gene, welcome to Here for Good.
Thanks, Dennis. It's good to be with you. There's a lot of pressure to be the inaugural guest in your 2021 season, so
that's okay. I wanted to kick it off right. You know, Gene, as I sort of mentioned in my intro, you've done a lot. You've had a career that have spanned over 30 years and really have been able to do more than most. But I kind of want to start with the beginning. What really drove you to healthcare? I know you weren't running around as a junior or senior in high school thinking you wanted to be a healthcare administrator. What pushed you towards healthcare?
Yeah, nobody knows what a hospital administrator does when they're a junior or senior in high school. And, you know, I had a lot of friends that want to be doctors or entrepreneurs or some type of business. I went to college not having a clue what I wanted to do.
Really?
Yeah, I had no idea, and it was just an expectation that I was going to go to college, whether I knew what I wanted to do or not. But by the time I was going into my sophomore year, I was thinking, well, I really need to figure this thing out, you know. And my mother is Spanish. I grew up in southern Spain because my father was in the military, and so we were stationed in the base there, and he met my mother there. And so I grew up in southern Spain, and I speak fluent in Spanish. And I've got uncles and aunts that are, you know, entrepreneurs. So I'm thinking, okay, well, maybe I'm an international business type person that launches an import-export business. And so I said, okay, I think that might be what I want to do. So I went to Penn State, and I went to a career day, which I thought was on international business. And Dennis, I had mixed up the days, and it was actually, it was the local hospital administrator saying, you know, healthcare is going through transformation. We need some young, bright minds to help us figure this thing out. And really, right then, I said, this is for me. And I signed up. Penn State had one of the largest undergraduate programs at the time in health planning administration. I signed up, and the rest is history, as they say. But you know, there's that saying that there's no accidents in the universe. And so I do think that there was some larger hand at play here in guiding me to where I'm at today. My first job in a hospital was actually as a director of quality. And so as I think back, you know, I had an aunt that when I was 10 years old, she actually died in the hospital of a medication error. And so, you know, when I became the quality director, I had a laser-like focus that nobody on my watch is going to die of a medication error. So I kind of had that purpose from the beginning of my career, which I still certainly feel to this day.
You know, it's amazing how, like you say, it may not have been by accident, but you accidentally showed up to the right place. And so you fast forward 30 years later, I mean, your career has basically led you around the entire country, from Washington, D.C. to Kentucky to Texas, and now in North Carolina. And you've also been in senior executive roles in regional and national systems, rural, urban, academic, community-based settings. I think, Gene, as healthcare leaders, we're no strangers to navigating the various needs and challenges of different communities within our own organizational footprint. But based on now the breadth of your experience, are there certain takeaways or key takeaways that you've learned over the years that have helped you to be successful as the CEO of Atrium Health?
Yeah, well, thanks for the question. The one thing is, because I've been in rural, urban, academic, community-based, I think if you look at Atrium Health now as one of the largest health systems in the country, we have all parts of that in our system. We have rural component, we also are in the city, and we have an academic mission. So I almost feel like all of those experiences that I've had up until now have prepared me for a role like this. But the one thing that, if I go back to my career, there's a couple things that stand out in terms of that no matter what setting you are in, there's a theme to it. And, one is just, and we've seen it this year, how heroic those that serve in our professions are. When I was, you had Ken Samet on the show, a good friend of mine, CEO of MedStar. I was at Washington Hospital Center, as I know you were too.
Exactly.
But I was there when, on day 4 of the job, we had September 11th and hit the Pentagon, and we were the first ones on the scene with our helicopters there trying to take care of folks. We took care of all the burn patients that came out of the Pentagon. And when I was in Texas with Christus, we were there on the front lines, every hurricane and things of that nature. So what no matter where I've been, what is common is that when everybody's running away from the fire, we're running towards the fire. And I think that's really what it just kind of keeps me going. That's the kind of spirit that we bring. And obviously, in this year of COVID and the pandemic, we've seen that every single day. So that still inspires me. The one thing I will say that's also common is, Dennis, no matter what organization we're in, we've got to figure out what motivates our teammates.
Yeah.
In Atrium, our mission is health, hope, and healing for all. And I know that just really galvanizes people. It motivates people. It's a rallying cry, and because they feel that our mission is authentic. And I think that's part of the job of the leader, is to find out what that mission. How do you motivate an organization? How do you inspire them? And that's really common to no matter the nature of the organizations that I've.
Now you say you've been in multiple organizations. Now, do you find that mission-driven organizations are really where the heart is, where your heart is? I mean, it allows you to really be the best version of you because you are working according to a mission. And that mission most often is about, the things that we do in the community.
Yeah, that's exactly right. I mean, I think you get fortunate if you're in organizations whose mission aligns with your personal values. And that's always, when I've gone to an organization, that's been my first check. Is this organization, what they're doing, aligned with what I believe is the right things to do? And the challenge is sometimes we've been in organizations, Dennis, where you've got a bunch of executives go away for a weekend retreat, come up with a mission statement, and then share it with the organization.
Right.
That's not the right way to do it, because sometimes it doesn't land. When I came here, I took the first 120 days, as I'm sure you did, and just talked from I was on loading docks, I was in outpatient centers, and what bubbled up for me then is what people believed in, what drove folks to really serve every single day in very challenging circumstances. So yeah, I think I am both attracted to mission-driven organizations, and as a leader feel it's a responsibility to model that every single day.
Now, last year, Gene, you were appointed to North Carolina Governor Cooper's Andrea Harris Social, Economic, Environmental, and Health Equity Task Force. And I know you had a major leadership role with the American Hospital Association, which you also led the Equity of Care Task Force. What do you see as the key issues today with respect to disparities in care? And what do you see as some of the solutions? You were mentioning how you are drawn to mission-driven organizations. You mentioned how speaking with your team members and the things that bubble up and surface. I know disparity in care is one of them. Tell me a little bit about the task force as well as the equity of care work that you've done.
Yeah, well, thank you. I think if we go back to our mission, say improve health, elevate hope, and advance healing for all, and that for all part is almost the most important part of our mission. And I think what those experiences, when with the killing of George Floyd, and this juxtaposition of a global pandemic and this racial inequality, it's really laid bare the disparities that you and I see every day in our facilities. But I think now there's a broader visibility to that. And what I've said is that, on the day that George Floyd died and was killed, there was about 2,500 people in this country that died because of health disparities or because of poverty or because of other structural racism. And so I think those committees and with the governor and others is how do we focus on what those structural issues are? And some of that is what we know to be called the social determinants of health. So we've at Atrium, we've invested $10 million in affordable housing. We have a Kids Eat Free program. We have food pharmacies and mobile food pharmacies. All those structural things that we see in society. We also are very focused on economic mobility. So we have a group here in Charlotte that's actually of CEOs led by Brian Moynihan, who's the CEO of Bank of America. And we're both focused on the structural aspects of the community. So pre-K education as well, but also this economic mobility. And so I think we have organizations that have a moment in time to not just forget about what's going on now, 5 years from now. We have an opportunity to really make a difference in this organization, in this country. And part of those, I see my role and our organization's role is to play a large role in that.
And Gene, I agree. One of the terms that I use here, it's about being purposeful. Exactly. As an organization and the things that we do, not just with those that show up on our doorstep to receive care, but how do we extend our reach in the community? How do we do things, to your point, that are impactful, both from a healthcare perspective, but also economically, also from an education, addressing those social determinants of health. So, but that has been something that you feel, have you been able to see progress either through the governor's task force or the work that you had done previously with AHA?
Yeah, I think a couple things in what you said. When we started in the business, they were called hospital administrators, and we were just worried about what happened inside of our walls. Now we realize we're managing health, and that happens as much outside of our walls, inside of our walls. Are we making progress? I think there are signs that we are. There are signs that we aren't, and I think I think we're having the conversation though. And I think that it starts with the conversation. And we've had, after George Floyd, we've had thousands of courageous conversations in the organization. And I think it really does start with that. And what I'm proud of though, inside of Atrium Health, we got 70,000 teammates of all walks of life, urban, they come from rural environments, Black, white, and we're inside feeling like we're committed to this common purpose. And what I tell my teammates is that the culture that we have inside, we've got to actually live outside as well as models. And I think that's the opportunity we have as organizations that we lead, is to really model what we'd like to see in society by how we treat each other, by how we work together.
Gene, you talked about disparity of care, talked about how we extend our reach. When we look at today and some of the concern around or surrounding the vaccine, is widespread, particularly in communities of color, who, as we've discussed in the past, have suffered disproportionately from the COVID-19 virus. Shortly after receiving our first dose of the vaccine here at Virtua, I shared some of my thoughts on how I believe leaders, especially Black leaders, can use this moment as an opportunity to build trust and also hopefully to give hope. Are you experiencing similar types of things among your colleagues and communities, and maybe how are you using your influence and status to help build trust and to be a role model for others, particularly people who look like you and I?
Mm-hmm. And I think, so the answer is yes. We're seeing that hesitancy both inside of our walls and outside of our walls. And so we sort of have a multi-pronged strategy in how to address that. But I think you said the operative word, and that's trust. Trust is the operative word. And, historically, there hasn't been a lot of trust in healthcare systems or research by folks that look like you and I. So, on the outside, when we were in the middle of the pandemic, we started off in April, we realized that there were certain zip codes that were having disparities in testing. And so we loaded up our mobile vans, put the testing supplies, because we were able to run our own tests, and also brought food and things of that nature to those neighborhoods. And we had trust in the middle of the storm. And so right now, we're working with the same community leaders. We're also working with a group of 60 churches, Black and Latinx churches, who know how we showed up in the heat of battle. And so we're working with them on how to reduce some of that hesitancy.
So you weren't new to those communities because they've seen you in the past. And so there was some trust. You didn't show up just as a result of this one thing. Your organization had long been a part of the community.
Exactly. I think that's very well said. We had a ground game of community engagement that I, and it was mission driven again. And I think those relationships have built trust, and they're looking to us to say, is this safe? One of the things I say is the Pfizer vaccine, for example, had 40% in the clinical trials with people of color. And
right.
So when you start sharing that information, and I think people then begin to both trust you because you've been there before, but also trust you as the voice of science. And I think those are the things that we've been really leaning in on this time. And we're making some progress. This past weekend, we vaccinated 20,000 people at Bank of America Stadium, which is the Panther
Wow.
Stadium, working with our partners, Honeywell as well. And so they helped us automate the flow. And we actually we had every 4.5 seconds, we had a shot in arms. But we had it downtown in the stadium because it's access to transportation. And yeah. We shared with the churches, hey, this is the schedule. You guys got first access to the schedule. And we had 30% people of color of the 20,000 that we vaccinated this weekend. So I think they're realizing, again, these are trust building moves that we can share. Hey, you can count on us to be there for you. We see you and we're here for you.
So we've talked a little bit about diversity as it relates to the COVID-19 pandemic. Let me shift gears just a little bit, Gene. Diversity and inclusion in the workplace, it's not a new concept, but it's certainly taken on more of a visible and more serious tone, I think, over the course of the last 6 months to a year. Where do you believe we, as healthcare leaders across the industry, have made positive strides, and what do you think still needs to be done?
Yeah, I mean, I think we've made positive strides in beginning to focus much more intentionally on the Institute of Medicine report that was done many years ago that highlight that if you control for income, if you control for insurance, there's still disparities. So nationally, as I'm talking to colleagues, everybody's much more focused on that and are trying to figure out how to solve that. We have more work to do. So I think, but I think I begin to see some progress when a disparity is identified that people are trying to lean in. Where I think we have more work to do is building structural capabilities in each of our organizations. So for example, I'm blessed. I have a board chair, Ed Brown, who helped Hugh McCall build Bank of America and also was the CEO of Hendrick Motors for about 14 years. And we had a conversation and said, we want this organization to continue to be focused on this well beyond our tenures. And so we're building into the governance structure. Every single board committee has to have a social impact agenda item, and that we're holding ourselves accountable for. We've formed a social impact committee of the board at the enterprise level that's going to look at quality, our banking? Are we diversified in our banking? And so I think the opportunity that we have is making sure that we have structural solutions to what's a structural problem. And
But
it's not an episodic.
has that been a heavy lift for you, or did you find that that was something that was embraced in a willing and open way?
It was embraced completely and totally. And that's the thing, that's where culture really matters. I mean, my board was all in 100%. Let's say, let's make this happen. The teammates were at 100% on board. The physicians were. So I think in fact, they were happy to see us go in this direction. So it's just what we call it, our For All mission. We've been engaged in the community for a while. This is For All 2.0 or 3.0. And so that we're ensuring that we're building sustainable structures to eliminate disparities. I think if I were to ask this new administration what we should be high on the agenda, we should have a moonshot for eliminating disparities in this country. And I think we should galvanize our scientists, our academicians, our businesses, our health systems, our public health structures, our elected officials, and have a moonshot to eliminate disparities. And I'd like to play large in that moonshot.
So you just recently completed a major strategic, combining of bringing in, Wake Forest Baptist Health and the Wake Forest School of Medicine into the Atrium family. Many systems have sort of paused on those big mergers. Why did you decide to go through with it? And, going back to the point that you made about merging cultures and how you get different folks to adapt different things, how do you see that being impacted as well? Bringing in a new organization to the family, how are you blending the cultures? How do you find that they will contribute to some of those very things that we're talking about? Because now you have a medical school where you can influence the training of a lot of our clinicians and making that a part of their process going forward.
Yeah. Well, you said the operative word. If you look at mergers across the country, where they fail is the culture. And you can do a lot of studies about culture, and we all do them before we come together. And sometimes they're right, sometimes they're not. I find that in negotiating a deal, what you typically come across as something really hard, really complex. And I always tell the team how we manage through those complexities as we're negotiating a deal is going to say a lot for how we're going to be together on the other side of this.
Yeah.
And with Wake, and every time we were dealing with something, challenging in terms of how, and we're dealing with a lot of stakeholders when you're dealing with this, we always respected the relationship. We always try to figure out what's the larger goal here. And it told me everything I needed to know during that process. Say they're going to be phenomenal partners. So we did all the studies, but how we were together in those times and how we were designing a vision for the future told me everything I needed to know. We've come together officially October 9th of this past year, and I got to tell you, it feels like we've been family for 5 years or 10 years or already. So I think so I'm really happy for the culture part of it. I think the reason why we did it is because we have the same vision for the future, is that we need to train the next generation of clinicians. We've learned a lot in COVID. It's about telehealth, it's about community engagement, it's about innovation. And so we thought that we couldn't delay. We're going to build a new medical school here in Charlotte, and we couldn't delay that because we wanted to make sure this next generation was trained with all the latest science and all the things that we've learned from COVID. And the other part of it is just this research infrastructure that we're now building together. In the middle of COVID, we actually signed up about 20,000 people virtually for a clinical study and around studying COVID and the impact of the symptoms. And so we felt that it was a very timely combination, if you will, because we had things we believe that we could make a difference better together than we could alone.
I don't think any of us can have a conversation these days without talking about COVID and its impact. Tell me some takeaways. I mean, it's been a challenging, this past year has been challenging for all of us. But as a leader, what's been some of your takeaways? What gives you hope? And then the second part of that, what keeps you up at night?
Yeah, that's a great question. I mean, I think one takeaway is sometimes I'm realizing how slow we were in the past to make decisions. Sometimes we form a committee and it'd be months and they'd study it. And then, a year before we implemented, we were making rapid cycle decisions, sometimes moment to moment, hour by hour, and implementing it. I'll give you an example. In the middle of this, we realized, like so many, that we were going to run out of hospital beds. And so we had a group of physicians and scientists come together and they said, well, let's do this hospital at home concept. So we call it now Atrium Health Hospital at Home. And so we were treating COVID patients. In fact, we treated 50,000 COVID patients so far in their homes with monitoring, with telehealth. We used our medics to actually deliver medications when they needed them or to do the testing. And so, under normal circumstances, that might take many months and a year to come up with the idea and to implement it. And we did this all in a matter of weeks, really. So I think that's a key takeaway. And I want to keep that going forward.
It's funny you say that, Gene, because we had digital transformation sort of on our near-term goal. Yeah. COVID made us accelerate things in a matter of weeks, what we would have historically taken years to do. So I absolutely get that.
Yeah, it's kind of pulled us forward like a decade almost, right? And I think we're going to hopefully stay there. What keeps me up at night is sort of this racial and the political divide we have in this country, and it's kind of affected every single aspect of life. And I'm hoping that we can come together. And again, to my earlier point, I think we can model inside of our organizations the kind of society we'd like to see in outside of organizations. But that does keep me up at night because we should continue to focus on the things that unite us more than the things that divide us.
And I have two last questions, but the point you just made, I think COVID has brought out the best of us. And it's also in certain situations based on where our nation has been for the last period of time, some of the worst of us. But one of the things that I have seen and have really inspired me is the philanthropic efforts that have come to light. I know Eugene personally and professionally sees philanthropy as a vehicle to continue to be here for good. Tell me how you inspire. You and I both, we talked about our kids a lot. How do you inspire your kids to take on a philanthropic, spin to the things that they do with their lives, or others, or colleagues? Your organization have been very philanthropic. You as an individual have been a leader in terms of making sure that you provide for those that might not otherwise have. What's the driving force, and what do you use as sort of to try and inspire others?
Yeah, I see myself of being where I'm at career-wise and in life because other people gave me opportunities, other people. And so it's this idea of paying it forward. With respect to kids, as you know, kids don't necessarily listen to what you say, they listen to what you do and how you model. So I've always tried to model that for both my boys and I really, they have huge hearts. They're both engineers, so they're doing what they need to do on that side, but they've got huge hearts, and I see it in how they engage with their friends and engage with the community. When COVID started, I went to my leadership team and I said, we've got a lot of heroes in there and a lot of folks are struggling. So I wanted us as a leadership team to model by making a significant contribution, ultimately 2 million of our own, from our own pockets to what we call the Heroes Fund. And I think that spurred, that fund now has increased, I think, about 600% because now we have others that wanted to give. So I think fundamentally, you've got to model it yourself, and it's something that I tried to do in my day-to-day life.
Well, my last question, and this is perhaps the most important one of the day.
Yeah.
What would your 18-year-old self think about the person you are today?
Well, one thing, when I was 18, so I'm a musician. I play guitar and I've written music all my life. And I remember,
by the way, I've seen a clip of a Dancing with the Stars video in which you actually played the guitar and, as my mom said, cut a slight rug, but we'll talk about that off camera.
Well, I'm not promoting myself, but if you go on the YouTube, there's a song that I got a music video out. It's called Not Enough Joy by Gene Woods. And I think I'm maybe cutting a rug better than what I did on my Dancing with the Stars. But when I was 18, you know, I love to do that. I love to play music, and I was concerned that once I got serious in a career, that I was going to have to leave that behind. Well, fast forward to today, I'm actually recording an album, and it's very much part of my life. And I think my 18-year-old self would have appreciated that I continue to focus on you know, working hard every day, doing what you need to do to make a difference, but also that you need to bring balance to what we do. You know, I encourage people to, you know, if you're a painter, paint. You know, if you want to run a marathon, do that, but carve time out for yourself, because that's the way, going back to Steve Covey, how you sharpen the saw. So I think that's what my 18-year-old. But I also think that my 18-year-old self would have appreciated the fact that I have found a career where I can make a difference. You never know that the hard work is going to pay off. You know, I like Steve Jobs' a quote that, you know, try to make a dent in the universe. So that's what I'm trying to do. I'm trying to stay hungry, humble, try to make sure that I continue to learn every single day, because if you're not doing those three things, you're kind of going back. So I think my 18-year-old self didn't know how things were gonna turn out, but I think would appreciate that. I feel like me, my team, the folks that I have, friends and the community, we're trying to make a difference.
Well, listen, Gene, I really want to thank you for taking time to talk with me. I think you really defined what it means to be here for good. I think you've done that personally. I know you've done it professionally. And just sharing some of your thoughts, it continues to inspire me. Not to cut an album, which I am expecting a copy of it once it comes out, but just
I'll give you a discount, about a 50% discount. So I'm not charging you full freight.
All right, I would appreciate that. But thanks what you've done for this industry and what you continue to do for the many people that your organization have an opportunity to impact. So, my friend, as always, it's a pleasure. Thank you for being part of Here for Good.
Thank you, Dennis. Good to be with you.